Here is a breast biopsy of a breast tumor. I think you're going to have to take it on faith that this is breast tissue, because there is virtually no place on here that looks like normal breast tissue with lobules, acini, yada, yada, yada. At first I thought this area here might have been, but when I zoomed in on it a little bit, I realized it was a nerve and it was not a residual normal breast lobule. Notice that virtually half of the specimen here consists of a tumor that has kind of a pushing margin and infiltrating areas like here. And this is the entire tumor right here. Everything surrounding it is normal fibrous tissue of the breast. When you look very closely at this tumor, you could see that it consists of these little lakes or pools of mucin in which a glandular material swims in the middle of. This is a colloid carcinoma. It's also called mucinous carcinoma. It's also one of the types of breast cancer that has a favorable prognosis in that it does not have an aggressive behavior as much as some of the other infiltrating ductal carcinomas. Whenever breast carcinomas are associated with these little lobules or pools of mucin in which you have these small glandular carcinoma areas, it's usually a good sign. Also notice that it does not have a widely infiltrative margin. However, I think if you look here, you can see this is clearly an area that is starting to infiltrate and kind of break away from the crowd over here. From a cytologic point of view, of course, this is probably true with many breast carcinomas anyway. You could see some pleomorphism here and perhaps a mitosis here or here. The cytology, however, is not as bad as it could be. This is a mucinous carcinoma of the breast, also called colloid carcinoma.